the back is presenting the opportunity for happy chi to happen. Happy chi. Come. So moving on. So the transition from the upper to the lower torso, key area here, all around the body. Hara, all through the body. Life gate, beautiful. So we'll spend a little time compressing. Same premise, right over the work. Here, compressing on the sacrum and pushing back a little bit so it opens up the lower back. There's the sacrum here. Take the sides of my hands and squeeze.
That's a nice one.
So we're squeezing, getting all the attachments here. Also, bladder meridian. So squeezing. Loosening the gluteals a little bit.
Yeah.
Kind of stuff I do. Kind of popped up on nut protein.
Will work for cashews.
Yeah. Absolutely.
Yeah, that bag was like $6.
Now here into the one specific side. So in these initial compressions, along with loosening the gluteal, think about trying to create a little space here, decompressing this area. So compressions down a little bit and away. Again, through extended arm, nice articulating flat fist, and along with the belly of the musculature to come up and compress into the bony landmark here, which is the lateral border of the sacrum. You can take your palm and put it over the contour of the greater trochanter of the femur and just press down, opening up the side of the hip quite nicely. Okay. Nice natural contact. Right here, and then you do an extended arm, lean your body weight in. That's like this. So, you're feeling pretty good about yourself. Then that was a nice move. Maybe I can do something else for the woman. So we're going to do a little mobilization here. Just below the iliac crest, using the knee in this fashion. So I'm going right between the sacrum and the greater trochanter. And you notice my angle, because that fits right in this channel here, right in this area between lateral border of sacrum and greater trochanter, right through the center. So you come slightly above the hip and bring in an angle while you're rotating. When you rotate the leg, it brings the musculature, the meridian, up towards the surface more. So you mobilize, and then you can have a better contact with the muscle. Really nice way of working the hip. So you get comfortable with that. You see here, bend knee compression. It's a very nice direct extension from Hara. It's like bam. So you have really nice solid contact. You just, with the slightest shifts, really help the quality of the contact. So you get the kind of pressure. Yep. Working here. I'm going to take the compression down into the hamstrings. So a couple things. We could always use palms. Now this might encourage in some of you too much pressure into the wrist joint. So there's a lot of options always. One knee. And I'd like you to try the knee. Try the knee that's the bottom knee, not the top knee. So you're opening your body with every compression as you work down. Pressure's okay?
That's a good point.
Now, maybe foot, easy. Maybe foot standing. the same premise though. You're over the work, leaning in on exhale. Same.
So good.
Little traction of the area we just worked on. And then we pick up where we left off, which is right here at the back of the knee. Nice, squeezing. I'm going to take the thumb over thumb and go right in between the gastroc head. Pressure's okay? I think the pressure's starting to wear off. Okay, so now a little bit more for the hip. So this last portion is putting the hip in figure 4. Now here we're going to be a little bit more specific to the attachments here in the gluteals and the IT band as it goes, the gallbladder as it goes through IT band and through Crohn's. And we have a lot of options as far as body placement. So my intention is to come up and use my elbow to address the hip, both against the sacrum for the attachments and the greater trochanter, but also the belly of the muscles. So if I stay on this side, some body types, this is very good. Get in. See how that feels. Other people prefer this position. This allows you to get in at a different point. See what works for you. You know, our body's acclimation changes, but intention always the same. So this is the area we were working on. So how do we accommodate that to make that happen? So change and check what works better for your body. I have a tendency to work this way. For me, I can just lean in a little cleaner for my size. Just like before when we were working the back, just nice flat engagement and then just slight raising here, relax here, working the area. And then taking the compression down, including the IT band now for a gallbladder. This lower portion here. And addressing gallbladder as it comes in front of the lateral malleolus so that you can apply pressure to source point gallbladder forming, the balancing point. And then digital pressure out fourth tone. And as we did a side stretch top leg, we're going to do a stretch here before we transition. So this leg to the side, to the center. And I'm going to, with my foot that's closest to her head, I'm going to stand on her small of her back. So very light pressure. Arch over the lower lumbar. Here's the sacrum, so I'm above the sacrum, right above the iliac crest. I'm going to not bend at my waist, but rather lower my hara down, grab a hold, inhale, and then exhale, just easy up. Nice and easy. Shoulders relaxed. Do a couple times. Inhale, exhale. Nice. In coming out of stretch, having the respect to come out slow. And then also, this motion of lowering the leg down takes you into transition to the other side. You can go right in and do that same sequence again. Okay? So we try that before lunch.